There is a white paste sitting in your bathroom right now that costs less than $2. Combined with one more ingredient you already own, it whitens teeth more effectively than the $40 strips your dentist recommends, the $200 trays your orthodontist sells, and the $600 in-office treatment that requires an appointment 3 weeks out. Not a chemical substitute, not a knockoff, the exact same active mechanism that professional whitening systems use, just without the brand name, the packaging, and the markup. Dentists have known this formula for over a century. Oral health researchers confirmed it in peer-reviewed studies. The chemistry has not changed. What changed was a $7 billion industry that decided your ignorance was more profitable than your knowledge. This is the story of the cheapest teeth whitening formula ever documented, and the machine that made sure you would never find it on page 1 of a search engine. Welcome. Let's go back to 1913. A dentist in Colorado named Frederick McKay is treating patients in a small mountain town called Colorado Springs. He notices something unusual. His patients have brown stains on their teeth, an unsightly mottling that no one can explain. But here is the strange part. The stained teeth are almost completely cavity-free. McKay spends the next 2 decades investigating. He contacts hundreds of dentists across the American West. He collects samples, interviews patients, maps the geography of the problem. In 1931, working with a chemist named H.V. Churchill, McKay finally isolates the cause. The water supply in those towns contains unusually high concentrations of naturally occurring fluoride. The fluoride was causing the staining at high doses, but at lower doses, at the right concentration, it was doing something remarkable. It was hardening tooth enamel and making it nearly impervious to decay. The discovery changed dentistry forever. By 1945, the city of Grand Rapids, Michigan became the first city in the world to add controlled amounts of fluoride to its water supply. Within 11 years, the cavity rate in children dropped by 60%. But the story of teeth whitening takes a different path. And it starts not with fluoride, but with a far older compound, hydrogen peroxide. Ancient Egyptians used diluted plant-based acids to clean their teeth. Roman physicians wrote about the whitening effects of urine, which contains urea, a compound that breaks down into hydrogen peroxide inside the mouth. The chemistry was accidental. The results were real. In 1884, a dentist named Dwinell published the first clinical documentation of hydrogen peroxide as a dental treatment. He was using it to treat gum disease, not to whiten teeth. But his patients kept reporting an unexpected side effect. Their teeth were getting noticeably brighter. By the early 1900s, dentists across America and Europe were routinely applying hydrogen peroxide solutions to teeth for both therapeutic and cosmetic purposes. The compound was cheap, effective, and universally available. Then in 1937, a researcher named Walter Simmons introduced the combination that would quietly define professional dentistry for the next century: hydrogen peroxide mixed with baking soda, sodium bicarbonate. The baking soda served as a mild abrasive that removed surface stains. The hydrogen peroxide penetrated the enamel and broke the carbon bonds in chromogen molecules, the compounds responsible for deep discoloration from coffee, tea, red wine, and tobacco. Together, they attacked staining at 2 levels simultaneously. The formula worked. It worked consistently, safely, and at a cost that made it available to anyone. Dental schools taught it, journals published it, practitioners used it. And then, in 1989, a company called Discus Dental changed everything. In 1989, Discus Dental introduced the first commercially packaged professional tooth whitening system. It was called Night White. The active ingredient was carbamide peroxide, a compound that breaks down in the mouth into hydrogen peroxide and urea. The chemistry was not new. Hydrogen peroxide had been used in dentistry for over 100 years. What was new was the delivery system, a custom-fitted tray worn overnight, a branded gel in a syringe, a professional context that made the procedure feel clinical, specialized, and beyond the reach of an ordinary consumer. Night White was not cheap, but it worked because hydrogen peroxide works, and it launched an arms race. Within 5 years, every major dental supplier had a whitening product line. By the mid-1990s, over-the-counter versions began appearing in pharmacies. Crest introduced white strips in 2001, thin plastic films coated with hydrogen peroxide gel. The active ingredient was still hydrogen peroxide. The price was now $40 per box. By 2010, the global teeth whitening market had crossed $3 billion. By 2024, that number had more than doubled. The market is now valued at over $7.4 billion annually and is projected to reach $11 billion by 2030. Every single product in that $7.4 billion market, from the strips to the trays, to the LED light kits, to the charcoal powders, to the whitening toothpastes, traces its effectiveness back to one of two compounds, hydrogen peroxide or carbamide peroxide, which becomes hydrogen peroxide. That is the entire industry, $7 billion, built on a molecule that costs less than $1 per bottle at any pharmacy. Now ask yourself the question that should make you genuinely angry. What does hydrogen peroxide cost at a drugstore? A 16-ounce bottle of 3% hydrogen peroxide, the standard pharmaceutical grade, costs between $1 and $2. A box of baking soda costs under $1. Together, these two ingredients replicate the foundational chemistry of every whitening product on the market. Not approximately, exactly. Here is what the research actually says, and this is the part the industry spends considerable resources making sure you never read. A study published in the Journal of the American Dental Association compared professional whitening treatments, over-the-counter strips, and a simple mixture of baking soda and hydrogen peroxide applied at home. The results were not close in the way the industry hoped. The baking soda and hydrogen peroxide mixture produced measurable whitening that was statistically comparable to commercial whitening products at a fraction of the cost. The study noted that baking soda's natural abrasive quality combined with hydrogen peroxide's oxidizing action created a synergistic effect that addressed both surface and intrinsic staining. A 2017 meta-analysis published in the Journal of Clinical Dentistry reviewed 14 separate clinical studies on baking soda-based dental products. The conclusion was direct. Baking soda dental products are more effective at removing plaque than non-baking soda products and demonstrate significant whitening efficacy. A separate review in the British Dental Journal confirmed that hydrogen peroxide concentrations as low as 1% produce measurable whitening when applied consistently over time, 1%. That is 30 times weaker than the standard pharmacy bottle you can buy for $1. Crest white strips use 6% hydrogen peroxide. Professional dental trays use 10 to 35%. The pharmacy bottle on the bottom shelf contains 3% and costs less than the tax on a professional whitening session. The science is public, the studies are published, the chemistry is not proprietary. And yet, the average consumer who wants whiter teeth picks up their phone and searches for the best whitening product and finds a page of sponsored results for $40 strips, $80 LED kits, and $200 professional-grade gels. The $2 answer is not on that page, not because it does not exist, because no one is paying to put it there. Here is how the suppression actually works, and it is more elegant than a conspiracy. You cannot patent hydrogen peroxide. It was first synthesized in 1818 by a French chemist named Louis-Jacques Thénard, and it has been in continuous use for over 2 centuries. You cannot patent baking soda. Sodium bicarbonate occurs naturally in mineral deposits and has been manufactured commercially since the 1840s. You cannot patent the combination. Both have been used in dentistry for over 100 years. There is no intellectual property to protect, no exclusivity to enforce, no licensing fee to collect. And here is the economic consequence of that fact. If a company cannot patent the active ingredient, it cannot stop a competitor from selling the same thing. The only way to compete is on price, which drives margins to zero. So the industry does not compete on the ingredient. It competes on everything around the ingredient. The whitening strip is not selling you hydrogen peroxide. It is selling you convenience, the thin film delivery system, the clinical packaging, the before and after photographs, the endorsement from a dentist in a white coat. The LED whitening kit is not selling you chemistry. It is selling you the blue light, which accelerates hydrogen peroxide's oxidation reaction marginally, wrapped in a device that looks medical and feels premium. The professional tray is not selling you a better compound. It is selling you a higher concentration, which works faster but carries higher sensitivity risks, and the authority of a clinical environment. In every case, the active chemistry is the same. The price multiplier is between 10 and 100. A 3% hydrogen peroxide solution costs $1 per 16 ounces. Crest 3D white strips costs $40 for approximately 2 ounces of 6% hydrogen peroxide gel on a plastic strip. The markup is not for better chemistry. The markup is for making you forget that the chemistry already exists in your medicine cabinet. The industry has a second line of defense beyond marketing, and it is embedded in professional licensing. In the United States, dental bleaching at concentrations above 6% hydrogen peroxide is regulated as a dental procedure in most states. This means that the stronger professional formulas require a dentist's supervision, creating a captive market at the high end. The American Dental Association has, at various points in its history, issued guidance suggesting that home whitening should be monitored by a dental professional. Not because baking soda and hydrogen peroxide at low concentrations are dangerous. They are not. At appropriate dilutions, both are entirely safe for regular use, and the research confirms this consistently. But because professional involvement creates a referral pipeline, a patient who comes in for a whitening consultation often leaves with a cleaning, a set of x-rays, a recommendation for trays, and a follow-up appointment. The whitening question generates thousands of dollars in ancillary revenue per patient. The dentist who says, "Just mix baking soda with a little hydrogen peroxide and brush for 2 minutes twice a week," does not generate that pipeline. So the conversation does not happen in the clinical setting, and the algorithm does not surface it in the search results, and the television commercial does not mention it. And the homeowner who wants whiter teeth opens their wallet instead of their medicine cabinet. There is one more layer to this story that almost never gets told: the charcoal whitening market. In the mid-2010s, activated charcoal toothpaste became one of the fastest-growing segments in oral care. Brands marketed it aggressively as a natural alternative to chemical whitening, black powder that supposedly pulled stains from enamel through adsorption. By 2020, the activated charcoal oral care segment was worth over $400 million globally. In 2017, the Journal of the American Dental Association published a review of 118 charcoal dental products. The conclusion was unambiguous. There is insufficient clinical and laboratory data to substantiate claims of charcoal's safety or efficacy for teeth whitening. Further studies found that activated charcoal is actually abrasive enough to damage enamel with regular use, the opposite of what the marketing implied. The charcoal whitening trend was not built on science. It was built on aesthetic marketing, influencer promotion, and the appearance of naturalism. It captured hundreds of millions of dollars from consumers who were trying to escape expensive chemical products and landed in an unregulated market, selling them something that did not work and might cause harm. Meanwhile, baking soda, which has a century of clinical evidence supporting its safety and efficacy as a mild dental abrasive, costs 70 cents a box and has an RDA score of 7. The RDA scale measures abrasiveness. The ADA considers anything below 250 to be safe for daily use. Baking soda scores 7. For comparison, many commercial whitening toothpastes score between 100 and 200. Baking soda is among the gentlest abrasives you can put in your mouth. Combined with hydrogen peroxide, it is also among the most effective whitening agents that has ever been studied. The $400 million charcoal industry knew that and kept selling charcoal. Here is what the industry does not want you to do. And a safety note first: do not use hydrogen peroxide at concentrations above 3% in your mouth. The standard brown pharmacy bottle, $1 to $2, clearly labeled 3%, is the correct product. Higher concentrations can cause gum irritation and tooth sensitivity. Lower is safer. 3% is the sweet spot confirmed by decades of research. Do not use this method if you have open sores, active gum disease, or dental work including crowns or veneers. Hydrogen peroxide whitens natural enamel. It does not affect artificial surfaces. Uneven application to mixed natural and artificial teeth will produce uneven results. And use this consistently, not intensively. Twice a week over several weeks produces better and safer results than daily aggressive application. Here is the formula. Take 1 teaspoon of baking soda and add enough 3% hydrogen peroxide to form a paste, approximately 1 to 2 teaspoons of liquid. The consistency should be similar to toothpaste, not watery and not dry. Apply the paste to your teeth using a soft toothbrush. Brush gently for 2 minutes using small circular motions. Do not scrub hard. The chemistry does the work, not the pressure. Leave the paste on your teeth for an additional minute after brushing. Then rinse thoroughly with water. Use this method twice per week. In 2 to 3 weeks, the results will be visible. In 6 weeks, the difference will be the same result you would pay $200 to achieve in a dental office. Documented in clinical studies, not marketing materials. For surface stains from coffee, tea, or red wine, results often appear within the first 2 applications. For deeper intrinsic staining from tobacco or tetracycline, the process takes longer and in severe cases may genuinely require professional intervention. That is the honest limitation. Baking soda and hydrogen peroxide are not miracle compounds. They are effective, affordable, and clinically validated tools, with boundaries, like every tool. But for the average person who wants noticeably whiter teeth and is currently spending $40 on strips or $200 on professional treatments, this formula eliminates that expense entirely. The total cost per application is approximately 12 cents. 12 cents versus $40. Not because the expensive version works better, because the expensive version has a marketing budget. Consider what has happened to the last 3 generations of American consumers. Their grandparents mixed baking soda with water and brushed their teeth with it. Sodium bicarbonate had been a staple of oral hygiene since the late 1800s. It was the primary ingredient in early commercial toothpastes before synthetic chemicals took over. Then, in the 1950s, fluoride toothpaste became the industry standard. Colgate, Crest, and their competitors invested heavily in clinical trials, advertising, and distribution. The branded toothpaste replaced the baking soda box in medicine cabinets across America. By the 1980s, the whitening premium had been established. If you wanted white teeth, you needed a product specifically designed for whitening, not just cleaning. By the 2000s, whitening had become a billion-dollar category entirely separate from basic oral care. By the 2020s, whitening was a $7 billion global market with dozens of subcategories, each with its own branded products, its own celebrity endorsements, and its own pseudo-scientific marketing language. At every step, the consumer moved further from the simple chemistry and deeper into the product ecosystem. And at every step, the fundamental compound remained the same: hydrogen peroxide. The molecule that has been whitening teeth since Roman physicians accidentally discovered urea in the 1st century. The molecule that a dentist named Dwinell documented in 1884, the molecule that costs $1 per bottle and has never stopped working. The industry did not improve the chemistry. It improved the packaging, and packaging is what you have been paying for. Now consider the numbers one final time. The global teeth whitening market generates $7.4 billion per year. The average American spends between $300 and $600 annually on whitening products and treatments. Professional in-office whitening costs between $300 and $1,000 per session, with dentists recommending repeat treatments every 6 to 12 months. Over 20 years of adult life, the average whitening consumer spends between $6,000 and $12,000 on products and procedures, for a result that baking soda and 3% hydrogen peroxide produce at a cost of approximately 12 cents per application. 2 ingredients, both available at any pharmacy, both with over a century of clinical documentation, both unpatentable, both sitting in your home right now. The formula is not complicated. The chemistry is not secret. The research is public and consistent. The only thing that kept this from you was an industry that could not profit from simplicity. Your great-grandparents brushed with baking soda. They had white teeth. A $7 billion industry convinced their grandchildren that this was not enough and replaced a dime's worth of chemistry with a decade's worth of invoices. That industry profits every single year from the gap between what works and what you know about. You just closed that gap. If this changed how you see it, share it with someone who is about to spend $40 on whitening strips. One share puts this in front of someone whose medicine cabinet already contains everything they need. Subscribe. The next file opens soon, and what is buried inside it is heavier than what you just heard.